Hi, I'm with Walpole's public health nurse Trish Fisher and Deputy Health Agent Megan Leary, who are here to tell us more about 2 upcoming vaccination clinics that are scheduled to take place this October at the Council on Aging. Can you start by telling us what vaccines will be available at the clinic and who is eligible to register?
Sure, we'll be offering the flu vaccine at our public clinic, and that's going to be for anybody ages 4 years old and over. The vaccines will be for children ages 4 years old through 18 years old, and then we'll have vaccines available for 18 and older. And then we'll also be offering the high-dose vaccine, which is for ages 65 plus. You don't have to be a Walpole resident to register, as my vaccine clinics are available on VaxFinder through Massachusetts.
Our first clinic will be October 1st from 10 a.m. to 2 p.m., and this is for residents of any age. And then we're going to have a second clinic for residents 60 plus, and it's going to be Monday, October 3rd from 10 a.m. to 2 p.m. And there'll be a health fair as well for the senior clinic.
Why should residents consider getting their flu vaccine this year?
The flu vaccine, especially over the past couple of years in the times of COVID, is extremely important to get because of the number of hospitalizations, decreased immunity. We've all been wearing our masks for so long. The strains of flu continue to evolve and develop and change. So the immunity, we just don't have it yet for the flu that's been coming out through last season and this season. Getting your flu vaccine is so important to be able to at least lessen the effects if you do develop the flu. Your symptoms are a lot less. It decreases your chance of hospitalization. And it just for overall health, as school starts getting back, a lot of places are getting to be in person again. Workplaces are in person. A lot more exposures out there. It's just your best line of defense with the winter months coming.
How does the health department go about organizing these clinics? What health professionals are involved, and from where does the town receive the vaccine supply?
So our vaccine for children, anybody ages 4 through the age of 18, is supplied from the state. Massachusetts Department of Public Health offers that vaccine to local health departments for free. Anything above the age of 18, the health department actually purchases that vaccine through a nationally known vendor. They offer the regular dose, the high dose, and that vaccine is usually purchased with monies that we have in a revolving account that we are able to continue to offer the vaccine as well as supply our clinics. Our clinics are organized primarily with the help of volunteers. Our Walpole Medical Reserve Corps, as well as our CERT team, are extremely instrumental with helping these clinics run smoothly. We have volunteer nurses that help administer the vaccine. We have volunteer nurses that are more comfortable with pediatrics, some that are more comfortable with the adult vaccines. We have volunteers that help us with traffic control, registration. Many of our volunteers have helped us year after year. They're pretty comfortable in their roles and they're always willing to help. But it's just this, such large-scale clinic, especially the public clinic, that our volunteers are unbelievable. So we just keep them informed. We keep the trainings going throughout the year so everybody is on the same page. They're aware of what vaccines we're getting each year. And then we usually will do a quick little training session before the clinic so everybody knows what their role is and what's going to be expected that day.
How do these public vaccination clinics differ from getting the vaccine at, say, a CVS or a primary care physician's office?
I feel that these clinics provide a lot of convenience, especially for Walpole residents. We keep it local. We provide a number of nurses that help keep their lines down. We have a lot more control over appointment times. We have a lot more control over the wait times to just really help keep the flow going. It's often a lot of familiar faces too for people that come to our clinics year after year. We have the same nurses, a lot of the same volunteers. It's nice to see a friendly face. And just, you know, the ease of it, just knowing that you're able to book an appointment, you have an appointment time, you know where you're going, and we keep it pretty pretty well run after the last couple of years. We have it down to a science, which really helps with the efficiency of it.
Are there any costs associated with the clinic?
No, the clinic's completely free, regardless of what vaccine. We just require an insurance card when you come, primarily because once the vaccines are administered, they automatically get uploaded into the Massachusetts immunization system. So that system utilizes and confirms your identity through your insurance card, and also provides an opportunity to have some administration reimbursement fees sent back through the health department to help fund future clinics.
And finally, how can folks register for the clinic?
So we use the Color program for people to register for their appointment times. You can find a link through the town webpage. If you go to the Board of Health page, there'll be a link through there. We also will have it in the town newspaper. We have flyers at the health department, and we will also advertise it on social media as well through Facebook.